Johnson & Johnson signs deal with Health and Human Services to develop coronavirus vaccine. This just came out today, February 12th, 2020. Johnson & Johnson announced that its subsidiary Janssen has entered in an expanded agreement with the Biomedical Advanced Research and Development Authority, or BARDA, part of the U.S. Department of Health and Human Services, or HHS. The company entered into the agreement to accelerate its investigational vaccine program for the new coronavirus named 2019-nCoV, recently found in China. Yes, that's the Johnson & Johnson that sat at the table of Event 201. The same Johnson & Johnson that laid out their plans for you right in front of you.
And I think before we agree that we have a finite resource, we need to really challenge ourselves on the vaccine production. We've seen historically that we can actually produce an Ebola vaccine in a year. It requires flexibility on the regulatory side. It requires commitment from companies. But I do think that before we say that a vaccine is not available, we should not slow down on that. We should pursue that. And I think similarly, we need to explore how could we accelerate production of our antivirals. We've seen it happen before in the HIV crisis. It's possible, but decisions need to be made, and we need to bring the right people together to do that.
Okay. And for the moment, before we are able to accelerate production of the antiviral, do you have any initial reaction, since you are potentially one of the companies that could be part of this deliberation?
What we've seen work very well in the HIV field is, in fact, procurement through the Global Fund. So having a centralized mechanism, so financially able to procure on behalf of affected countries would be critical. I think the second thing is it's going to be very important that for the business sector, for manufacturers of antivirals, that we have clarity around what the need is and where the need is and who are making the decisions.
And told you exactly how it needed to be done, when it needed to be done, and how they would do it, how their company would do it. And now look who has gotten one of the contracts. Just another coincidence? Johnson & Johnson had announced plans last month to develop a 2019-nCoV vaccine with multi-pronged approach. The company has already initiated the process to identify compounds with antiviral activity against 2019-nCoV. This collaborative partnership with BARDA will help the company to share research and development costs related to the 2019-nCoV vaccine. See, there's your money. BARDA will help them share the cost. The funding from BARDA is likely to expedite the progress of a promising preclinical candidate into phase 1 clinical study. BARDA may provide additional funding to support its future clinical development progress. Meanwhile, Johnson & Johnson will focus on expanding manufacturing and production capacities for any potential 2019-nCoV vaccine candidate to meet the currently increasing demand. Exactly. They have all the demand in the world right now with the panic and the fear that is being spread by this so-called virus, by this so-called epidemic. The company will leverage Janssen's AdVac and per.C6 technologies for development of a coronavirus vaccine. These technologies have previously supported the development of Ebola, Zika, RSV, and HIV vaccine candidates by none other than Johnson & Johnson. So they've been involved in all of it. They were involved in every one of these other outbreaks. The company is also working with its worldwide partners to search its library of antiviral molecules for rapid discovery of a potential candidate. That's exactly what they said in Event 201. He said directly, we must not think that we cannot make a vaccine that fast. We did it with Ebola, and we can do it now. And that's exactly what they're showing you right now. Shares of Johnson & Johnson have gained 13.3% in the past year compared with the industry's increase of 13.2%. Now look at this. It's a great day to be in a pharmaceutical company, isn't it? Great day to be behind these vaccines and these diseases. The World Health Organization has declared the coronavirus outbreak a global public health emergency as the viral infection has spread to more than 20 countries. The disease caused by the coronavirus found last month in Wuhan, China, has been officially named COVID-19 by the World Health Organization. Per a recent Bloomberg article, more than 40,000 people across the world have been diagnosed with COVID-19, majorly in China. The death toll has reached 1,113 in China. Several countries are taking precautionary measures to contain the risk of an outbreak. Primarily, Gilead's GILD antiviral candidate, remdesivir, is being administered to infected patients. We note that remdesivir is not approved for any indication globally. So they're already testing these things on people. Apart from Johnson & Johnson, several other pharma/biotech companies are engaged in developing a vaccine for the deadly 2019-nCoV. Earlier this month, Regeneron Pharmaceuticals, REGN, also entered into an expanded agreement with Health and Human Services to develop a 2019-nCoV vaccine. Moreover, modern mRNA and Inovio Pharmaceuticals have received grant from CEPI, a public-private non-profit organization, to develop a similar vaccine. Please note that the same Bloomberg article stated that although new cases of COVID-19 were found outside China, latest data shows some signs of easing of the outbreak in China. Although these signs look encouraging for public health, containment of the outbreak before successful development of vaccines may negatively impact pharma companies that are investing in developing a 2019-nCoV vaccine. Moreover, another Bloomberg article stated that investors are developing short interest in some of these small biotechs following the initial hype. Exactly, the initial hype. That's what this is. That's the whole goal, is for them to hype this up, to get the panic, to get the fear, because then they have a demand for this vaccine that they are trying to create, supposedly. Do you still believe that these vaccines are being created to help you when they say right here, although these signs look encouraging for public health, containment of the outbreak before successful development of vaccines may negatively impact pharma companies that are investing in developing a 2019-nCoV vaccine? Exactly. They need this to stay in the news. They need this panic to spread. They need people to be worrying about it so that they can get the millions and millions and millions in funding into their corporations, into their companies, so that they can make these so-called vaccines that control you and I. It is all about the money in the vaccines. They don't want this to go away. They don't want this to get better. If it gets better and it goes away, nobody is looking for a vaccine, so nobody is donating and sending millions and millions of dollars to these companies. You still think this is all a coincidence? You still think it's a coincidence with Johnson & Johnson sitting at the table at Event 201, laying out the plans, and now they're following them to a key, and their company happens to be one of the two that gets the funding from the Health and Human Services? It's time to see through all the lies and make sure that you guys tell whoever you can what's really going on. Thank you all for your support. Stay strong. Do not panic. Do not fear. God bless.